grounded, brave, it's ours. It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world, we cover what matters. We speak what others won't. West Coast.
Good afternoon and welcome again to our health program on West Coast TV. As we do over here, we are much more concerned about your health. Osande mpefika wansɛm de obi benyanwa no fi yare. Ama me no wansɛm inara efi yare. So of course it means that sickness, causes a lot of impediment and challenges. And at West Coast TV, we are always here to give to you education through the various experts that we invite on our show, so that at least you can take preventive measures against certain sicknesses or illness. We are coming to bring to you a very special topic as far as health is concerned, and it's about tuberculosis. So please stay tuned. We'll take a breather. We'll join you shortly.
It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world, we cover what matters. We speak what others won't. West Coast TV, grounded, brave, it's ours. It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world, we cover what matters. We speak what others won't. West Coast TV, grounded, brave, it's ours. It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world, we cover what matters. We speak what others won't. West Coast TV, grounded, brave, it's ours. It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world, we cover what matters. We speak what others won't. West Coast TV, grounded, brave, it's ours. It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world, we cover what matters. We speak what others won't. West Coast TV, grounded, brave, it's ours. It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world, we cover what matters. We speak what others won't. West Coast TV, grounded, brave, it's ours. It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world, we cover what matters. We speak what others won't. West Coast TV, grounded, brave, it's ours. It begins on the coast where Ghana greets the sea. In the heart of a hunter, voices rise with purpose. This is where stories breathe, where truth finds light. From news to culture, from the village to the world.
Welcome again back on West Coast TV. This is the our health program that we are bringing to you, so that at least you can, like I said, you can take preventive measures, or you can take a very good care of your health. Today we are looking at tuberculosis. Tuberculosis is a very big word, but don't worry. We have the experts here who will take us through to make it so simple for all of us. So please, today my dada bia call Facebook. Just search for West Coast TV. You share, you like, and you bring us your comment. Our experts are here and they will take us through. Let me introduce my team or the guests of the show to you. Your mame, Mavis Ankuma Say. She is a public health promotion expert or public health officer. We also have Holy Hoke. He is a general nurse at Aguna Kwata Polyclinic, right? Oh, okay. So you're welcome. We also have our sister, Deborah Kwenu. She is a senior enrolled nurse. So this is the team. There's another person of the team who will also join us shortly. She is Eunice Kujo. She will join us shortly. And they are going to do justice to the topic. So let me welcome my team. Aunt Mavis Akwaba. In fact, African, you are still in Ghana month, right? You look good in your African way. Yeah. That's the whole of March. Okay. Yeah, so it looks good on you. Auntie Debbie, you're welcome. This is West Coast TV.
Thank you.
All right. So today, like I said, we are going to discuss about tuberculosis. Without wasting much time, let me move straight to Auntie Mavis, so that I think she has done this work for a long time. In terms of the public health, how many years in the Hunter West?
Since 2005.
Wow. Yeah. Wow. So no. Atianda, it's a hunter.
Inyo.
Kedia.
Abokoye.
Okay. Yeah, so she really hears a hunter one by one. So I think gradually you get
I'll get there.
But we are talking about tuberculosis. So tell us, tuberculosis. What kind of tuberculosis are on Abedi?
Thank you very much, Mr. Eboa. And then I want to use this opportunity to send my regards to the Municipal Director of Health Services for Ahanta West, in the person of Mr. Emmanuel Badiana. We usually call him Yellow Man. Yes, so wherever he is, my regards to him, and then the management and staff of the Aguna Kwanta Health Directorate, and also to the management and staff of Aguna Kwanta Polyclinic, and all our viewers and listeners. Then every Thursday, and then so every night a bit. I'm saying now watching you see what the World Tuberculosis Week, but the day in itself fell on the 24th March. Okay. Now watching it's this whole week ye twesi one say they bought say in Samanwa and in Sanawa home they like the name implies the cancer tuberculosis. The name sounds very big, but what the buyer can say more. Baby nine nimnos as in Samanwa, it means to nimno as in Sanawa. It is all share in Sanawa, and I just say a wa or a day or sunny. Say, I mean, will be Namabo good, and I'm hinting good. Now say, Bono or the Arabano Banu, a bit more. I want to say bit to my head, a bit to me, and not to say Arabano or a day or sunny. Okay. So, like I was saying earlier, now watching ye debo tuberculosis deal. So yeah, TB and I sense Samanwa is very contagious and an airborne infection. as obi nye bi a obetumi a transmit it to another person, but it's caused by there's this bacteria called the Mycobacterium tuberculosis. Them as sebe once man am ebe hu de once man or rekwe ehu de abo ebi ntontom reba ebe hu de ntontom no rebe ya ebetumi ekunu no. This germ is not one that you can see with the naked eye. Jide ye de nipa no na ahoro anase ya afa ne honim dua na kwa bi ne da akwhye machine man san ye hu de germs no ana aboa na ye ka ho ase na ye Mycobacterium tuberculosis no ebi woni pa ne den na hraum anase ebi woni ne peduanim. So you can't see the bacteria with your naked eye. So ni nyina kan kofua no ma ye kan ne de tuberculosis anansa manwa no yareba no osa ebiem soso no is airborne. Bacteria ne etanam inflamum and it's very contagious. That notwithstanding, let me say we have the active tuberculosis and then the latent tuberculosis. The case will be latent tuberculosis and manwa. As I said, the minipano has the TB. All right. As I said, we're coming into contact with the bacteria, but does not show any signs and symptoms and unsensuania or chede yareba no ayede wenya or today sebe obi enya yareba bi today HIV/AIDS na otumuko oba yareba no nka no nto honum. The person has the virus all right, but on show unsensuania say yes obi enya AIDS or they do any pedum yehu de nipa no yede or yar
latent no
so you have the bacteria but
okay
say obinya interim casting your latent and active
yeah.
It's an active dia no and no very contagious. Say so do active TB nipa no obowa ye ndodo a ye wode mo obetina yintem na so obowa at this point in time no the number of bacteria nipa no they are active, they are multiplying and they are growing. It's no one obo no bacteria no releasing into inflammation nyina they are contagious obetuma na ye den ye nyebi compared to latent one na or habo and also our bacteria no woni nipeduenum but then on show nsencheni bia and nipa no latent TB and shedanye infectious but nipa no active TB that is a very contagious
that's dangerous.
Afufro yes with me dem afufro.
Oh okay, so for example assuming the year what they may obi will be that's all obowa I mean the active one.
Yes.
Wow. Wow, then that is serious.
And I want to say that normal say we have dry cough. Any other normal cough na so binya kata na cold obono. But this particular one, before we suspect someone say active, say latent TB, as any panwa between 2 to 3 weeks. I want no showing the onye ye. Ebim pokra also ginger na other way combination or boko obo obenum drugstore and as a pharmacy shops in bebre cough mixtures na de. We won't say even after 3 weeks one onye de onko. So no I was so obo wonka ye there no. This cough is not what ordinary. Ena yareba no so no nye huhum yareba no aka de bi obi no ore ye obi na wato ekotena sebe ya yeta for public transport ekotena taxi me ekotra trotrum na so biri bowa na ne de ne ye active TB aye na e worker ni nyina no we are at risk of getting the infection. Yes, I with me yareba no. So that is about the latent and then the active TB and it's airborne.
Wow.
It's airborne. Yenya no one from him.
All right, I'll come back to you once again. Maybe, sir, the thing for the World TB Week, you know, and what you intend doing, so that at least, I think the key issue is about awareness, okay,
yes, exactly.
And making sure that you let people also know that there's access to health, and it can be prevented. So I'll come back to you on that. But let me go to our sister Deborah. Deborah Kwaba.
Thank you.
Ever had chalana? Me no can hint na maybe sir. Now, but for how long have you been here working with?
Maybe 3. I was working at Accra, but I came here 3 years ago.
Oh, okay. Which part of Accra?
Ashaiman.
Yeah. Hey. Anyway, so Akwaba.
Yeah.
So we want to find out our Aguna Kwanta Polyclinic. how madam we TB nenia de action. It sounds or it seems that it's very dangerous, and we want to find out at your facility. No? Do you have statistics of TB? Is it high? Is it low?
Yeah.
Tell us what is going on as far as statistics is concerned.
Of course, we have. Since, yeah, madam, okay. Thank you very much for giving me this opportunity. I'll use this opportunity to greet all our listeners and then our viewers. Me did say, yeah, madam, I got most of it, and then me to also say me ba Aguna Nkwanta TB units statistics no was show kakra. As at last year, 2025, from January to December, we were able to screen about 300 patients, and then it was about 50 patients that were positive.
Wow.
So
here in Ahanta,
Aguna Nkwanta alone. Okay.
Oh,
yes.
okay. Polyclinic one. Wow.
Not like something that organize baby na screening and now we just at the facility.
Wow.
And it was 50 patients or more positive. So how many there most of baby to say Aguna fear some baby are overcrowded. But we are trying our best to educate them on it, and then we are on it, so we are managing.
Okay.
We are managing.
Holly, let me come to you. So however handle because bachelor. The
2010 number.
Hey, wallahi. You are approaching 30 years.
Only
27 years.
20 something. Not
Okay. No, natural. Oh, okay. So this year, 80 phone.
Individual.
Individual. And I a fufu so.
Fufu
so baby. Oh, okay. And a top a photo.
A third year.
Okay. Fufu. Yeah. Oh, okay. Meaning that Kasane disease are the transfer good be and I say. Adainaka.
Oh, Mendabis.
Abesim kala. Oh, okay. Mane aye de nti ye show we say akwara ka hanya nda kama ya na abakumvuro no mama say akwara dia, so we want you to do that for you. But okay. Say obinya tibia. Okay. Abade no chede ni pa no nya tibi.
Okay. But I say for a question. Me share it here for you now. TB, yalba udin kana. Minister, maybe so kind of nsamanwa ana nsanwa. Nti obi answer be suspect that we nya TB no. First of all, obebowa. The one so obebowa for more than 3 weeks. They are not just any partner. A bit more suspect in there when you're TV. And a one so ogba we amaman a hot. A boy na ya, na a horn say 2 day be na mojawu.
One of the signs in there is a nipano cougher, right?
Yeah, over cough or cougher, obey sputum.
So be a cough be another obo be actually when you're them.
I bought one for more than 3 weeks.
Oh, okay. Or a continuous. Okay.
More than 3 weeks.
Okay.
Na eya mama.
Okay.
After mama, so then moja tuyado. Etumi the moja wo. Ebitu ma suspect them nimpanda over TV.
Oh, okay.
Ebi so ha ebu na ne do little.
Okay.
Etumi the nimpanda ediba na wedi ni ona na wedi. But still ne do little. Them nimpanda so na obowa.
Okay.
Ebitu ma suspect, ebitu ma hospital na wa check.
Oh,
there
okay.
Will be another onebi.
Oh,
okay. On there obowa na chete will be ebia na wo issue with the land. Before we can confirm, let's say yeah test.
Okay.
Or just say mobile ni bi wo umu.
Okay.
Also the bill ebi so ha ebu there anajo na a sweat.
Really?
Yeah.
The we do light and the light to the fan BBS.
Light is to do fan
AC.
Yeah, na el sweat.
Oh, okay.
Onion normal. One say him the normal to you no and sweat. But elbow na el sweat anado. It's a sign.
Okay.
Na ugo ha oya de kakra na wa bre. Kakra na de one kakra no okofo. Ono so yes sign. Or that banner check the mobile room another avenue. Your system, your system, your lymphatic system. That way your body no.
So that can I hunt
I hunt the mean too.
Okay,
Lymph no they are fluids are also in fighting against infections.
Okay. Okay.
So your lymph nodes. If we are not with you, corn, even the lymph nodes no over mado. What kind of swelling?
Okay.
Swelling lymph node. Say if them instance and another science here. Ono or throw the ABA na TB into the hospital. Now what check what she said. Mobile room another evening. One say you ha oba na either or so.
Okay.
A casa cry or casa number papa. Nina Eka science no hobby.
Oh, okay.
As time goes on, we'll be adding more of it.
Okay. But obetu one band nipa no ologbo one so onya TB. That one too is also
yes. Oh.
Okay. But the easiest sign that nipa no continuous. Okay.
More than 3 weeks.
Okay. Onje. One may do
cough mister onje.
Okay.
So that at the hospital now. Yes.
Nah, what sure. Oh.
Ego home pa na onye TB no ba na oye issue with the land.
Okay.
Okay. Nti eba the best thing is to come to the hospital. Even them science here mabody bia. Then we take your sputum.
Oh, okay. So Madam Mavis, TB na nkasa no na a chim do ye nsa yare, right? But which part of the body, how does it happen? Like then TB, nipenya TB. I mean, which part of the body is affected the most?
I'm say most of the time, say extra, we have the lungs. And then in Shushamu there, say apart from the lungs, say more than one partner ahrawonuma, they can affect the kidney, they can affect the spine and other vital organs of the body. It's in a ahrawana and a lungs no pet and a TB more one go to near them. It's not. They can affect other parts of the body.
Oh, okay.
It's one ahrawanima, ubutuma potna or spine. Fiti, your poetry has say, and don't pin on adequate to say your twice one don't put sa line or down on a spine or honum. Butum so apart potna on the kidney and then other vital organs are a winniped.
Oh, okay. Auntie Debbie, my main bisa, TB, no draw. Is it treatable?
Yes, TB is curable.
It's curable.
Yes.
Oh, okay.
You treated TB. You treated TB. Until almost all be bowa. No fear or you know some person be bad. Say ni se bu or say oni stack of pharmacy and the umbra. TB treatment no free.
Oh, free.
NHIS
afana.
NHIS aben class here free. The daddy na yentu ya hwe.
Oh, okay.
It's never treated for 6 months. When we do from 6 to 9 months, but it depends on the severity. But mostly you treat it for 1 to 6 months, like 1 to 6 months. The treatment is free. You see, you want 2 types. Back with a combination, 4, and a back on ye back way free. Near the other come and 3. Into the combination for 2 months. Now if you want one kind for 4 months, now back now 6 months. And so I won't know one year. Now no kakra na we hu se o me ho ato me kakra ese wo na ekọ na we jai ya afi be build resistance nze bedu bebi no obenu medu no hu se enye adwuma ta afi na yesa yen refer nko bebi na o mu increase nti wo ho na wo bo wa na we no aba hospital na ye screen no say positive na ya ma wo mo wan no e curable e ko nti no wo ba ye be treat you fine and so ye free ye nje hwin say ya na mo ba ye treat
me po ma the free aspect.
yes
Of course, you will not spend that time. Me here no Olarefe. Tentemla, Edward non contact polyclinical. Show and they will give you the treatment that you deserve. Ma me welcome your mommy and our young sister Eunice Kujo. She is a disease control officer at Agunan Contact Polyclinic, right? Or is it the health directorate?
Yes, please.
Okay, so from the health directorate. Ono obeche what kind of fruit what I said in fruit fruit on said there so obia enya TB on said there the one who can cry she will take us through, but let me be on Auntie Debbie. Also I think she has talked about the treatment aspect of
yes,
the
please.
TB. I want to find out the dietary recommendations obia when you TB no also the OD.
Okay. Obia when you TB no. When we say sisi an immune system na ye weak. Ye kan immune I say wan ho ode ananse apomiden no aye weak akofom. Nti be di aduane a ebe ma wan hoden. Aduane ebe ma moja. Nti bi ti say obedi aduane a proteins ahye mu ma. Ye ka proteins e bi ti say kosua, e bi ti say nam bibia aha na nduane a moja ti se nkontomre na ade na odi na ama wan hodi na we di fruit nso fruit no nso no enye ni na obedi sanse bi wo ho acid wo nti wo bo wa na omnimu ayeko no wodi a ebe hyehyew nti fruit bi ti se banana obedi fruit bi ti se pawpaw obedi aha nti sa nduane no na we didi ye na wa rest eno no na a balance immunity no na say treatment ni ka ho na wo ye fiber.
Oh, okay. Into anya such a
anya such a yendi oily foods.
Anya KFC as.
That be anya KFC.
But you can wente.
Anya KFC asem, anya pizza asem, anya ice cream asem. Anya shawarma asem.
Yeah.
Yeah.
Tell them.
Very local foods but healthy, nutritious.
Oh, okay. Okay. And this say yeah can year. Not just say even to take care of our health no
yes, of course.
Those things that we have in our farm and garden.
And balance that it's
okay. Auntie Eunice, let me come to you and ask you. About eka fruit, as I say, yedi. There are others that you should avoid, specifically say about TB. A boy and through that. For how long have you been a hunter? Or you are a hunter?
No, please.
At Yanda?
No.
So for how long have you been here?
Just a year.
Just a year. National service or?
Yes, please.
National service. Oh, okay, that's good. And you are with the Public Health Directorate.
Yes.
Oh, thank you so much for accepting to come and serve the good people of Ahanta. We appreciate. But so can you help us? Fruit nipa when you TB another sayari and necessary OD.
Okay. Until like fruits and I say in your baby or honoma or be a one ya TB and I say one ya cough and I say cold on
okay.
A be a anka orange and lime, yes.
Oh,
yes.
okay.
Because anka or high acidity level like a bit me trigger so when ya cough na and a pineapple. Pineapple also so a bit near my throat no I discomfort. Say be a man na shishu ebi wonka obo wa crampa na mo jeffrey mo eba a pineapple too can trigger that situation. And I will cold apples. And also so a bit near trigger. They have some enzyme inhibitor.
Cold apple.
Yes, please.
A bit more.
Like apple. Some people would chill the apple.
Oh,
yes,
okay.
If you make me the apple, I share fridge, I freezing it, then they will say blog or ma and no me a camera so they can take in it. And also so bet me a trigger TB no so wonya and I boom so on so wonya TB na you don't have to take in alcohol e be bon ma mame nkotwa kakra ebe ma mboa na ewo oyem no ahihye ana say ebewu eno no enye fine.
Oh, okay.
And I boom so on ma you shouldn't take it like already made food.
Okay. Processed foods.
Processed food.
Canned foods.
Yes,
nah.
canned foods
Okay,
and things.
okay.
Yeah. Everyone, so far as they're selling it on the market as a cheap price and things, they can get it and eat it. That one too is not good for our health as a TB patient or a client. Yes.
Oh, okay. So, please, that is to your hearing. So, lemons you should avoid, canned food you should avoid. At least, they won't contaminate now or backyard or no. That's what you should be interested in. Aunt Mavis, let me come to you and ask you. So, how can one prevent TB? Me mpede me nya TB ni bi. Abakwana me fada. Ni nkonya bi.
Me say bebre nti no yen ka ana ye fan free time of COVID-19 yare baba yi. Em say na ye body with there obi an hye nose mask.
Oh, okay.
Em say COVID ne ba fuma aban yi ni say free those preventive measures protocols na I don't know obi an so de ne nose mask etufo.
Man kasa men kai the last time me share nose mask.
And the nose mask no is for dual purpose.
So when you COVID nkotin.
Enya COVID nko.
Oh, okay.
Yare be bia yenya no from mu bia say nose mask na it protects you.
Okay.
And the yedikan akade is contagious and is airborne. It's a Mycobacterium tuberculosis no. Say ekodomu na obi habo ana obi wo active TB. When pa ko na ogbo wo kuhu from him. Ayina you nyina no. You can only be saved when you've shielded yourself by wearing a nose mask.
Okay.
And by your mind and say this tradition is still there. Say o say nyina human behavior o say nyina di ehun a gym ni yesisa ni maybe. There akwetena car mu na car na ofa nipa 4 ofa nipa 15 na ekutika em na obo kuku. Ekuka chende onfa hankin kata na ano. Another onfa ne tama na bibi mpo a nipa na obehihye wa horo ba there. Dentina but ebi a wo so no ate the message a enim ha ko enim ewa na obo no enim what it contains say onipa na active TB a say kale mu aya ye wo mu nyina we stand a high risk of what getting the bacteria from umframana ye home no until say we should be each other's keeper and health no apomden enyi nipa kro ni deal ofa ye nyina ye ho. But my sense is say I passengers and so be bowa in that regard now. We should be nice. How we approach the situation. We should say it in a nice way. Oh, one temperature. What time one get the kata one or kakra. Another a bit more bowa gu. One sunny day elbow ni day. Na then abowa a day gu. Sa shirt and sooner a shower a bit me action shirt na be nim kakra. Na bowa na then egu. And no in there. The bacteria is still with you, but ambowa anyede engu mframem. Nti say we should be each other's keeper na ho kakra no. Yen hwe ne yenye hu bibi. Eti nose mask no, yen san kofa, yen san fambra. Na enye COVID-19 kwa na obabo yen ho be free ho. Then again, this one with moframa no, ye best friend, yen ba no worry ko school a. I will so bad thing bi anhwe den ne bekita handkerchief and I say tissue.
Okay.
The TB is airborne, but then sometimes so do or yaribano, not the person sneezes or coughs into a flat surface. Now say another person on year infected, at the ninsa, a fat the table no, and the flat surface na you can weigh hints and a wild boy where release the bacteria no one. You can also pick it. You can also pick it. Into house kakani, yen share. And a handkerchief no see and can't say no school phone. Ubo in my classroom who do be hanky out of food no I day. Now I didn't so no on yanede. A bone super cram of farm and a bone on my handkerchief no. What they name him had no, what the paper decks no da, none no. What did we are, not that paper and sound. And as a never ban as of a day or paper any part of the body. Now or the other part now one farm paper flat surface no. no ways they are children, so some of these things are likely to happen. It is a share na man, we have challenges in this regard that we should rather promote the tissue. A use tissue new year you what you throw it away. Na yen kan che yen ba no hu do bi ni hanky da baby a mo nye den mo mfa, and it's very important. Then yen ma me ni yen nuanom a wotonto na diban e wo kwa ho no se hwe aguna kwanta takwade kwan ya yele ye a be do obi chi bo fruit no oye de pa wa chi no oye de pa. I said, no, if you get exposed for a long time in the dust, because a airborne infection, you can pick the bacteria by the roadside. You can pick the bacteria by the roadside. So say, I want to turn the ban upon what's so no way. Wash it now. Wash one those masks. Again, I'm say Food and Drugs Authority and Environmental Health Department. I'm say, woman, I want to turn the ban. Where is screening be? The best stress said them exercise and so by them. Obe intensify dem a ebe hu there obi oriton e diben bia no onimi status na diban na oton say diban na nkofo bebre ta be gudu bebre a e wode nose mask no ye den ohye onu susu hia pa etino na say hwa minus by virtue of adwuma na occupation na ebi mu ye no awon na wo ye adwuma wa asase ase no e wona asase ase na kasanframa na wo no the ventilation no how well is it? Until when you are underground, when you show nose mask, you can put me a bomb actually. Until once so now when what tower you juma underground, you know, they are at risk of developing what? The TB. Until almost so now say as part of occupational hazards and occupational health, you know, I was say a jumeku or mu juma one so no, I'm putting measures in place ebe bo workers no home by them am underground one kofa yare baby an ye den enfamba. Then again, you can preventive measures. You best say, and say a woman says it's a real no, but ventilation is very important. Okay. A cohine there, a wadash ventilation aspect and also. So the woman there, dank it, maybe uncle for ni pay a woman, a kuna year, and then my bed there 5 and 6. It won't say a dining poker no more than no more check. It won't say window, kitty be no there or down. So ventilation is poor. Oh baby, and nipa more than 3 or 4 tier and more. And I know yet to overcrowded places. I know some communities in Ahanta West here. I'm sharing and I'm when I'm obini da chibi wana akupo obini bedroom. And with a dan obobo a dan shisha holy is a new room dino. Them not and then I'm a dan chibi wana akupo be say sorry and I'm about copy obini guay. It's baby a dan obobo the number of people women were crowded no. They stand a risk of getting TB. That's when one person has the active TB. I want to work on preventive measures and so say I can. TB screening is free. You can walk in at any point in time to Aguna Kwanta Polyclinic, to Abra Health Center, to Disco, Upon Wine Health Center, Baby Biara Health Facility, where you disease control unit. What your TB screening will okay. TB screening is free. The treatment is free. So you can walk in at any point in time. So now saying bear 1 week in me mobile, bear 2 weeks in me bow until next better where they will free. My be any day be ma sputum container say what's a profile then Fabra. Ebi opokrana akrono or the beba na or the beba na into su. Ebi mu how I will be see bring out the sputum. But then we have experts a woba boa ma wetumde rice sputum anasa akrono edaba near that question machine na ye investigation ni ahwede an ebi a mycobacterium TB no emo awan ebi anasa enye den enye bia ena afesu so enye ewa bia na che de eye TB yemba no aye na aye wo fridge wo yemfie no moframa no ebi wo no wo wia wo ho wo we blog e wo fridge ni ebi nso wo no ma ice water etini yemba no so yen check won ena afesu ye hu de se weather no wa asisa na se awowo ma moframa no yen kan wongu de mu ntem adesa yen hye won tare obekata won sa na won na nyina afensu so no kra no TB no nye huhum yareba. There are instances ebe ko garden ebe ko nsori fie bi no na ya age ye nipa bi ya age won egu honom ye se ye huhum adwuma ye nyina ye gi Kristo di em se Ghana Health Service se enyanyame mpokra no wa so ye mu a besi sa ambre etie de yekoti na onye de onye ye da nanso ye so soro boa de oboa no ho nyankopon o mfi soro mba na obesa yare o de befa nipa do or the befa nurses do or the befa doctors so then one do it is said by hospital no diagnose wa men ji chin awo edru no wonye woto do a num wedru ni pepepe enum wedru wi a na afeso na akosofo no na erenum no so de mpai body ye den or the tie wechi but then say eja edru no to honom na say the koda asori fia ehun de yes oye contagious no ehun nipa no obowa be de na na finyina ye ne ya ebe otumu bowa na dibam so no affect omo appetite nti obo obowa na afi wa ye ketekete tan hwekra be ka de se be wenya ya ebe bi ti de HIV AIDS mi wa na bia enye AIDS eye TB ena wa ye ne de to obo wo hwe mesi ma first na nko ti no mu ye du fine ne mo wa bowa wa ye ketekete obeka de oye hunhumu yareba dem ma me kan ye du no ye free eba na enu to do a between 6 to 9 months ye monitor wa enu medru no ebe ye fine e wani nyina obekọ what appetite no obeba ebetu medi di fine afi wo mudu no so obesana ye den obesana aba afi na ebe hunde yareba no onye contagious emma emfa yareba no nko ye den emfa nkoma afoforo na mesre say ye wo moframa no foforo a em say we have some antigens some moframa no ba we yi na ye de ma won obo won ho ban we yin droba na ye de wo moframa no ebi e contain di fence TB bambo ni bi etin se wa abofraba e da be wo na from 0 to 5 months or there shede ni be ko we antigens ana say droba na de wo moframa ni nyina we da afra no ye de onya ni nyina pepepe onu so baba abofraba no be free TB yareba no nti TB no enye mpanyimfo nko ana wotumi nyansama wa na nsane wa moframa fokra wotumi nye de wotumi nya it's about time we no so mo fa anye de mo fe ndago ena ye free bibi multiple drug resistance bebre na woba wonu medun kakra fe ohun de improvement aba ohun de body no reba kakra e wana aba fom pe no aye den wati ada e bane de ma e ma bacteria na esro no esro emuawa no te bedu bebi na dun ye de ma okra na onye den onye ejuma oba de ma ejuma no ni ye den ni ye dzin ma ye oba de ma afa ni ye tu epede ye tu yareba na sinso anu aye den wa ye dzin oba de ma wode yesa hye treatment regimen nyina se fufuro it wa ye there ku school na wa bo repeat at school na wode ka dey 3 years you know awode wo fe for graduate more than 6 years e da so gina wan na mu oba ne dem a ohu nto wa ye so ye hu nye de ye hu nto it I think say the measures kakra akra ma body so bia ma nani da honom afa nchichiwe no ye nti nchichiwe no ye ntodo ye ndi nkwa na diban bebre ena say TB client ana nsama we wako hospital me akade enya nsane we bia brown rice brown sugar ono no bo ni pedua ne sen white rice ena white sugar bread no so ne benya ka brown bread and I say wheat no and it feel good ono no yes ne white bread no it we did me say ko disease control unit and baby I want my treatment for tuberculosis na and I sense samanwa unit and asanwa unit na ediba na ebedi kwana be fada show hu di ye wo be cheche de munyeme nyina but samba na de koda sorry fi amba no ankata no eto edru e wo pharmacy and drug store in an attempt to say one kasa pedi treating wa and sure by the time e be do hospital no na che say we do advanced stage a ebetum cry den ahwe wo nkwa eti e be sre TB is curable TB treatment is free one jiska Jide TB na de bae no ye treat wa na bia yes ko ye lab na de akomudo malaria wo yakomude bia typhoid nsusu wo typhoid na malaria na kita insurance be fa ho ka no enkita insurance ono do no be ye wa wo ka ba ya ye TB be yi de treatment no ye den o ye free nti so bi wo yare ba ni bia nti se nipa no obo ni ho an osuro de obeka de oliba hospital
all right so on na yama me mavis one kind of especially COVID-19 measures na you use but it's a yama me molecule it means that we should continue our hand washing, the use of nose masks, sometimes is it distance,
social distance
so that's a bit you use, right? Then I think during COVID, we were not shaking hands. Yeah, but now we are. But
still, chapel. I love you with the love of the Lord. From one who if you cried, there was a protocol.
So all these things we should
go back to
observe
it will still protect us for some of these airborne infections or diseases.
Okay. Auntie Deborah, my main bisa obi nya TB a wetin wa yejuma.
Of course, obeti ma yejuma. Obeti ma yejuma. Say on do stage why you weak to extent say why a bedridden because TB no otum kunipa into otum ye o me very weak to extent say bedridden. So under them stage na ebetima edwa but just protect yourself in a way so you will not spread it.
Okay.
Nti enim dey wo TV obi mo ho onim dey wo TV so betina tro ma na wa hye do ko nso eba na ye no be kasa dey she face mask at least petition na your poly bag bi kita ebo ho na that ebo ho na she face mask na be obi ote won cha na edwuma obi oben onye bi but obusiafo ya kan still nti no yesra mo se mayendi so obi o TB obetumi aye adwuma obi o HIV obetu se wo bubu ngum pa so nkwa dia nso no bon ho ban se na ebe ya nya ye ben nso yenye.
Okay, nto obetumi aye adwuma. Auntie is mama mbisa assuming there's obi nya TB we treat him more wako is there possibility that obesa na nya TB ni bi mana?
Yes, please.
Oh, okay.
And treatment, you treat it from first 1 month to 6 months.
Okay.
Ebe mo ho no ma, omo take a drew 4 months, no, omo say like a one akokra mo go be, and so they'll stop taking the drug. And no, e basa na mbo no, e bi da so wo.
Oh, okay.
So you have to take the drug to complete the 6 good months.
Okay,
yeah.
okay. Until anyadama there is the possibility that
yes,
you get it back. Okay, so before that is for your hearing. Some way somehow we have exhausted what we have for you today, but let me go to Auntie Mavis and ask her for her final words.
I'm saying ebe sorry so no. I'm say epede da ye ne ahwefo nyina se na ne krakra no ma mpeda me kan ne de TB nsamanwa anansane wa yare no oyare ba osan oyare ba yenya no wonframem apart from framem yenya no by virtue of adwuma ani eye te sa wona wo ye adwuma wa asase ase awona woto na diba no e wo kwan ho awona wota tena baby a ye overcrowded places a won share nose mask na bibi obobo ho ban no so obi wo active TB no wo wontema obowa anase se ohinti in that environment I na you at risk of getting it. TB treatment no or free yenjiska and the cure rating so no 99%. Jide and then certain na onye pe but nipa dodo a yen want to do no do a woshum enu madu ni pepepe edibana wode wodi ye ka kire won bibia wo ye bia no yi advice bi edwon won bia no wo di bi pepepe no the microphone what yapo etiti be onye huhu yareba obia betuma enya abofraba betuma enya penyi betuma enya so eye na wotwe nyina akoye world TB week no you can walk into Aguna Kwanta Polyclinic eba ese hwehwe baby a disease control unit no ewo ana baby a TB fun woje wona duru no eba ye be free screening at the amount. It's in a free TB screening is going on at Aguna Kwanta Polyclinic. It's rather unfortunate and the last day, but you can still walk in, say a riba, now be screening for TB.
Okay. So until then, after Ochina, no, still now, Obiba is still free.
Still free.
Oh, okay.
Free.
Okay.
Everything is free.
Oh, okay.
Screening, you take your sputum, everything free. You start the treatment. If it's positive, you start the treatment still free. So you are done with the system.
So if you're outside Aguna Kwanta,
no here no will refer. If it a cardio, if you here buy everything free, you start the treatment free.
Okay.
And Aguna Kwanta nkwa, baby I will be a big one, and baby I will be and so you free.
Does it apply to everywhere. Private hospitals?
Yes, please.
Private hospitals are more treating it free?
Yes, please.
Oh,
still
okay.
Free.
Okay, then that's great. Auntie Eunice, Hantaman Lesho, what are your final ways?
Okay. Meda West Coast TV station, Meda Masi Bebre, and I made municipal health directorate for nso ase bebree na me madam health promotion officer madam Mavis nso ase bebree na me da ahwefo nso ase bebree.
All right, so West Coast nso da ase bebree. Auntie Debbie, on TB yakasa bebree, what will you tell my viewers as your fan now in the form of advice or anything?
Nti kakra yebe finalize ne say nyamesre ne say busuafo yina we are at risk. En fa say wo beka say wo bank wo hanti no e de yan ada ko e bia o ka be say wo be fa chocho e bia na obi tim na wan kwata na me say ni senti me na yen fa ni serious obi tim fie maybe we neighbor won ka say onye obusu ni nti won fi ni say we fi ni na obo a na wan protecting no ho so you at risk obetimi enya nti so obi bo say ni say na advice no obetimi aba hospital Aguna Kwanta hospital ho market chips compound ho Aguna Fie chips compound be bia obeko bia ye be ya mo efin to de oni ne kwa eno ani say mpa chom hwehwe be bia e wafo no wo uko be bia next for no mo hwe e wafo no uba enu obedi nkomo fine na ya chere ya do split na ya test enso no ma won feel there wo de wunye nipa stigmatization sometimes enu ntina ya bi mo mba and I say ye twetwe ye ho say ye no best refine no say wo be show face mask na ye share face mask na ya bon komo na ye ne wa asro kama e bibia ya kama ye say dem ase some amount of opportunity we na ye dem bon komo twetwe komo about TB nti man na madam in charge ase with the West Coast TV station for us district. Thank you for everything. And then
all right, so West Coast TV, so that was for taking time out of your busy schedule to be here. Now, what is church in Sanya, how it happens, how the symptoms, the signs, and I can't nipa for Adokrampa or prevent because that is key. And look, it's a more coding and Yarabana is so scary and it's so dangerous. So please, COVID-19 protocol measures, or my engagement. I think Auntie maybe made mention of that, and I think we should be careful about that. So, Mame Sominda, West Coast TV team, especially my producer, Ase. Na Menda, me MC Abakope. And dazzling. I think last week I traveled to Accra. Yes, and she did a good job. I was watching her from afar. She did a good job. So kudos to Queen. Vichechia Obia Mamenda Auntie Mavis Naniti Miso Ase. Earlier on we had Holy with us. Holy Akba Maunera. So he also took us through some of the topics. Menda Auntie Debbie Asi, West Coast TV is grateful. Auntie Eunice, West Coast TV is grateful. And week in, week out, we have been having this show every Thursday. Every Thursday, we are 1 hour bob 11 hours. Quickly switch to West Coast TV and watch what is going on. My deba is about your health. What pomidin. Wapomiden osande so obi benya wa no fi yareba ama me no wan say inara efi yareba so let's take good care of our health so I make kind that me da obi bia so ase on our sharing Facebook live yada obi biara ase nyame yadoma next week we'll bring you another interesting topic concerning our health on the same channel on West Coast TV. Into menko baby, about me kind of show ye. Ahantaman here, Ghana man here, we be sharing here. Into show ye na ankofa or how be a obodo. Na ya show ya ye. Na ya nyama betu me ya de aboa or man Ghana. Me that's it. Nyame adoma that Sunday.
It begins on the coast where Ghana greets the sea. In the heart of Ahanta, voices